Vanessa, Amanda, thank you so much for being with us. So at Intermountain, we are filming here at HIMSS 17. We're filming a lot of healthcare leaders and talking about, a lot of it is about patient engagement, patient activation, those sorts of topics. And it wasn't until we talked to Mandy Bishop this morning, and she said, well, what patients are you interviewing? And the production crew looked at each other and we're like, we're not filming any. Well, that's so stupid. Of course we should film patients. Of course we should get patient perspective. So that's why you're here, and we're thrilled about it. Tell us a little about your background, how you got here, what you do. Vanessa, let's start with you.
Okay. I'm actually from South Africa, so we are very behind in terms of health IT. I'm a patient, I'm an e-patient for antibiotic resistance and facial differences. So, yeah, that's what I do.
Okay. Amanda?
Well, I'm here as a social media collaborator with the Personal Connected Health Alliance. Mandy Bishop, as you mentioned, is a social media ambassador for HIMSS. But the social media collaborator program for PCHA is a little bit smaller and getting started. And I'm a patient, and I said, let's connect.
All right, love that we have. So first question, we asked Mandy this, by the way, as well this morning. If you fast forward, say 20, 30 years, your grandkids or great-grandkids, as the case may be, when they're looking back at 2017, what are they going to shake their head at? What are they going to see that we do in healthcare now and say, you did what?
Well, I live with a chronic illness. I'm LA lupus lady, so I live with lupus, which is an autoimmune disease, and I also have fibromyalgia, osteoarthritis, rheumatoid arthritis, and multiple other conditions. And I very luckily go to, my primary care physician is with UCLA, and my rheumatologist is with Cedars. And those are two internationally renowned medical institutions, yet my EHR and medical records don't talk to each other. There's not like one Amanda Green record. They want to duplicate tests. Well, what's your lab work? I'm like, I just did it 3 days ago. I have the results on my email. How do you not talk to each other? Can you forward this to my doctor at UCLA? No. I mean, and when asked, as simple as that, can you forward this to my doctor at UCLA? No.
Nope.
But you can send me an email. Why can't you send it to my doctor at UCLA?
Yeah, that is silly. That seems really silly.
And it seems really simple.
Yeah.
But there should be a single patient identifier system. And so, at least at HIMSS today, I have hope because Lenovo Health US is working on something like that. So maybe in 20 years, we'll be like, it took forever to get to this point.
Yeah, it'll seem crazy then.
I shouldn't have to be a patient, a caregiver, and a healthcare manager. And I've met a lot of people here that are very smart in health IT, but I think I've got a virtual PhD in health IT with my own personal case study.
Yeah, okay. Vanessa, your perspective on that? What are your grandkids going to say?
Yeah, she's actually got a really good point, because one of the problems that I've always seen is, the way that doctors communicate with each other. And when I had my facial reconstruction, I had close to 53 medical reports.
Did you say 53?
53 medical reports.
Wow.
600 pages of medical history. And, to try and, that took me a decade. It took me a decade to do a facial reconstruction, and in the end I ended up with MRSA, antibiotic resistance, where doctors were prescribing methicillin more than once at the same time, simultaneously. And as Amanda says, not having a central medical record was part of the problem for me. And so, I mean, we all know antibiotic resistance is a massive issue at the moment. They've just had meetings with the UN. The other thing, where you're saying that what would our next generation be wondering, what we never did was, why don't we look at things globally? I know it's got a lot to do with costs and policies and that sort of thing, but we really need to start thinking about the fact that we travel, that we have trade, we have global trade. We can't shut ourselves off from each other, and the disease doesn't know any borders. So health IT really needs to look at that holistically, and I think as well the socio-economic determinants, that education and that sort of thing. I base a lot of my work on the SDGs, which I feel, the World Health Organization have actually spoken about how all the SDGs interact or intersect with SDG 3. And I think that that's a good starting point. If you want to build an ecosystem that really works, you've got to look at everything, every contact point. if you're talking about a smart city, programmable city, where are you getting the data from? Are you getting it from pollution? Are you getting it from what time we sleep? Are we getting it from fitness? I mean, we're only looking at it in a sort of a bubble
Yeah.
that doesn't determine really what makes us human. So, yeah, that's my perspective.
So if you were in a room with all the healthcare leaders in one room, what would you tell them? What would you admonish them? What would you say has been the bad and the good of your healthcare interactions?
Well, first I would say thank you. And then, because you give them a little bit of massage, and then you say, by the way,
The sandwich theory?
you're gonna be a patient one day too. And as somebody with a chronic illness, I have a lot of experience. And you want to be treated at and looked at in the eye rather than, and I love health IT. I mean, data is important. But when I'm in the exam room with my doctor, there still needs to be eye contact. I don't want my doctor typing. I want him looking at me,
Yeah.
talking to me, and then writing it down. Or even having do you mind if I record our conversation? And then he gets to figure out the notes.
Okay.
And when it's a conversation with me, he's like, oh my God, I just typed up your lab notes. Thank you so much for reminding me to get back to being human and the whole health of a person. It's not just what your lab numbers are and how do we monitor your meds, but how are you doing here as well as my joint pain.
Yeah. A couple of our guests have talked about how there has been an erosion of trust in healthcare between caregivers and patients. Do you think that's true? Have you felt an erosion of trust between healthcare and patients?
For me, I had to go doctor shopping after my doctor of 30 years retired. And pardon the term doctor shopping, but to build, I mean, after 15 minutes, not like, oh, I know I can build the trust, but you know that, oh, this person and I are not going to get together. And I love style, and, you know, it's important to have a manicure, but one of the doctors I saw had, like, nice long nails with nail art. I'm like, whoa, her nails are way too nice to be my doctor. And I'm not saying that, you know, she shouldn't have time to take care of herself, and self-care is important for everybody in the medical profession, but my doctor, my rheumatologist, does not have her nails done. And not that that matters, but to me it was a symbol of, like, I don't know if I can trust somebody whose nails are that nice. Like, it's nice to compliment her manicure, but do I want her in charge of my lupus? Or part of my team?
Okay. Vanessa, what's your perspective on that?
Yeah, I would say definitely, because you know, I think this comes down to the e-patient sort of movement, where it's so important to understand that movement, because you know, patients have started having access to more information. So if you look back 15 years, you know, we just kind of were paternal. We didn't ask our doctor any questions, but now we have access to all this information. Just to give you an example of my story. When I started reconstructing my face, I didn't know anything. I looked in the mirror and I thought, they can fix this. I've seen Dr. Ray on TV, they can fix this. But I had multiple fractures in my face. I was very bad. And when I started my journey, I actually realized how complex the damage was. I didn't know which doctor to start at. But, you know, to cut a long story short, eventually, when the surgeries were a failure because doctors weren't working together, I mean, I wasn't even sure at the time. Then I really sat down and I started researching on the internet. And I found a lot of the US websites. Eventually I connected with one of the hospitals here, Brigham and Women's Hospital. They're doing the face transplant surgeries.
Yeah.
And, you know, they gave me advice on the Skype consultation. And within 8 months, I had direction. I was actually pretty lucky because I was seeing a plastic surgeon that initially said to me, Vanessa, don't trust Google. Don't use that. You know, it's terrible. Don't Dr. Google. It's a waste of time. But when I walked in and I said to him, but this man has told me that I need a zygomatic osteotomy and I need this. And I started using all these words that he also wasn't too sure, you know, at the time, because he was a plastic surgeon. He wasn't a craniofacial plastic surgeon. He was a microsurgeon. And this is a problem with super specialities. You know, they can't advise what a maxillofacial surgeon does and a craniofacial surgeon doesn't. So you do end up losing trust because most doctors, not all of them, but many of them will tell you they do know Not many of them will tell you they don't. Not many of them will refer you to the next one. And that's where I lost a lot of trust. Because I had the direction, but I realized what was happening in my circumstances was I was getting the wrong advice. And I think being connected with all this technology, when I walk into doctors' offices and I say, where we are right now with bioprinting, if they don't know, why should the patient know? What does that do to trust? Well, the way I'm walking around here, when I go back and I start telling my doctor what is possible, it does break the trust. So I think that health IT and doctors, they really need to sort of, there needs to be some sort of a meeting point, or because patients are kind of, I'm at a point now where I would insist on saying I want my medical record to be central. I don't want to end up with MRSA again. I don't want to be just prescribed antibiotics. My child who gets ear infection, I don't want him to get antibiotic prescribed several times that ends up getting a superbug where he dies.
Right.
And this is a major problem. So yeah.
I want to ask you one more question about transparency. So, which is kind of another hot topic in healthcare, transparency of how healthcare works, the cost of healthcare, the quality of healthcare. Some detractors, some people who don't want complete transparency would suggest that patients can't understand the complexity of healthcare, of quality metrics, of what means quality and what doesn't. What do you say to that? How do we make it digestible for anyone?
Well, I'm unique. I'm considered what I call an actively engaged patient, and not everybody who's a patient is going to want to know as much as I do. But I'm all for clarity and transparency. I want my health team to collaborate with me, to communicate with me, and if I have questions, I want them to answer them in terms that I understand. Because I'm in this body 365, 24/7. They might only see me 15 minutes every 3 or 4 months. And for my treatment and my plan, I'm working all year, every day of the year.
Yeah.
And so are they, even though, it's not like telemedicine, but if I have to make a phone call or if I have to send an email to let them know what's going on in my body, it's a team. And with the transparency, I want to know what the health IT companies are doing. I want the health IT companies to invite patients to be part of the process, not just like, oh, we've developed this for patients and here, try it. In the development process, include us in the what do we want? We need it to be easy. We don't need 27 apps. If 3 will do, we want the 3 best apps. I'm living with a chronic illness. I don't have time. And I want health IT to work for me, but by working for me, it's got to be transparent, clear. I want to know who's got I want to know that it's secure and private, but it's also, if I want to share my data, that my doctors can communicate with each other. So
a lot of interviews, a lot of pilots, surveying. What's the best mechanism you said, bring you into the process early on? What's the best actual mechanism to do that?
Ask me.
So literally call you up.
I'll say
hey,
yes.
Amanda. Okay.
Not every patient's going to say yes. Some people are too busy trying to just function and have a quality of life. Or I'm not a lupus mom. There's plenty of people that are lupus moms, but instead of a lupus mom, I'm a lupus advocate. Because there's plenty of people that, hey, you go be a lupus mom, and I'll go advocate. I'll be your voice with the Intermountain at HIMSS. And you've got to include patients, because we're the stakeholders. Patient engagement. How many times do you see patients on a logo when you're at this expo?
Right.
And, hi, I'm a patient. It's the scary face, and you don't want to scare them. But it's really, if it's about patient engagement, why don't you want to engage me in the process, or at least for a 5-minute conversation here at HIMSS?
Mm-hmm. Interesting. Vanessa, what's your perspective?
We're going through a sort of a transition period. We've got the public and we've got the private sectors, there's a lot of emphasis. We obviously very. We've just signed for the Sustainable Development Goals Agenda 2030, so we're moving towards a universal healthcare model. That's difficult to comment on because we haven't got there yet. But from a personal perspective, I think that really knowing, I've actually never received a quote from a service provider that has been completely thorough. So that bothers me.
Yeah.
quite a bit, because you never really know where you stand at the end of the day, what your bills are going to be. And, with my facial reconstructions, I never really know if it's going to be covered or not, because as a cosmetic, who knows, and then, of course, the other thing that concerns me a little bit, when you're talking about, like, transparency, I would love to see how many hospital-acquired infections are in a hospital before I go there. I would love to see that. I think that in terms of transparency, that's important. Yeah.
Okay. One more question for you. I said one before, but this time really I mean it. Let's assume that you're queen for a day of healthcare. You can do anything you want, make any changes you want, any edicts you want. What do you start with? What's day one of your reign as queen of healthcare? What's day one include?
Global policy. Globalized. Yeah.
So universal care system-wide, or just systems and experts connecting globally?
I think that systems need to collect globally. I think that it's pointless to try and build a system just in North America when everybody's traveling all over the world. And I don't think that security measures at the airports is going to catch any of these viruses or diseases or bacteria that are going through the borders. So when we talk about precision medicine, I don't think that is precision medicine. I think that, like I say, the only way to do it is to do it on a global scale. So,
okay.
Yeah.